Good day, everyone. I am Maria Charisma P. Estrella, and together with me are my group mates Faylinn LICARDO, Rohn Claude MERCADO, Leianna PARIÑAS, and Roanne Felice SISON. Today, we'll be reporting on a journal paper entitled Social Egg Freezing Under Public Health Perspective, Just a Medical Reality or a Women's Right, an ethical case analysis by Borovecki et al. In 2018. To start off, let's first delve into the importance of why we need to deliberate this specific issue. When we talk about healthcare, its main purpose is to deliver medicine, cure, and care to people of different genders according to their various needs. Specifically, this includes various procedures that are done only to biological males and for females as well. An example of this would be social egg freezing. In this, we define social egg freezing as a means to preserve and store a woman's oocyte for quote-unquote non-medical purposes. So, some view this procedure as medical, while others view it as non-medical and it's only driven by societal pressures. With these clashing perspectives, it is significant for us to really determine the status or the true standing of social egg freezing, as it can actually change the issuance of subsidized public healthcare depending on its recognized purpose and effects. To provide background, fertility preservation has been an emerging field providing opportunities for people to maintain their reproductive health. At first, this was given or provided to people who have to undergo harsh treatments such as chemotherapy and radiotherapy, which are detrimental for both female and male gonads. However, through the emergence of social egg freezing, this provides patients, especially female patients, the option to still continue with the treatment and still have the opportunity for childbearing in the future. Initially, egg freezing was only offered for medical reasons such as preserving the fertility for cancer patients. However, private fertility centers and the media began promoting the procedure to healthy women who wish to postpone motherhood due to reasons like education, career, or lack of a partner. This is because a woman's reproductive capability is a ticking time bomb. Female fertility is not only affected by harsh treatments, but also by time. As time passes, the ability of a woman to reproduce or procreate decreases together with their ovarian function. Until finally, when a woman reaches a certain age, they will undergo menopause, making them unable to reproduce. A lot of fertility preservation techniques have since then emerged in the field. These include oocyte vitrification and elective cryopreservation for oocytes. However, with the emergence and the availability of egg freezing for healthy women, this has then garnered mixed reviews. Some see it as progressive and flexible, giving women a peace of mind, while others see it as a societal pressure brought about by the workplace. With such a dilemma at hand, the case study of Borovecki et al. In 2018 aims to create an ethical argumentation on the topic of social egg freezing to determine if it really is a proper solution to harmonize gender differences or if it will only be a new innovation giving further challenges. Let us now look in the paper's attempt in dissecting the definition of social egg freezing, specifically with the terms of social and non-medical. According to the paper, the term social in social egg freezing does not really imply a social activity involving others, but rather it refers to a treatment performed based on an individual's desire. So it is not considered a social act of solidarity or altruism like organ donation, but social egg freezing would only become social if a woman chooses to donate their frozen eggs to another person. Because of this reason, this paper tries to identify that it is not a social act. In terms of it being a medical or non-medical procedure, the paper stated that age-related infertility prevention is a significant motivation for women to freeze their eggs. So the act of oocyte cryopreservation is seen as a preventive medical treatment rather than a non-medical choice. Therefore, labeling it as social freezing may be seen as judgmental towards women who want to take proactive measures to preserve their fertility. And with this, the paper recognizes it as a medical procedure. So with these presented ideas, it is evident that this study recognizes that social egg freezing is not really a social activity and is more of a medical procedure motivated by prevention. However, with the newfound definition of how egg freezing is, this now raises the question of whether maternal age can be considered a disease and if social freezing can be seen as a solution to age-related fertility decline, which is regarded as a medical problem.
Social egg freezing, also known as cell-site cryopreservation, is a procedure that allows women to preserve their fertility for non-medical reasons. This technology is often used in conjunction with assisted reproductive technology, or ART, for future use. The ethical considerations surrounding social egg freezing revolve around the balance between individual autonomy and beneficence for both the mother and the potential child of that mother. So, what are the risks and benefits of social egg freezing? Like any medical interventions, this poses inherent risks, especially for women undergoing IVF ICSI treatment as they age. Women over 50 are at higher risks of pre-existing chronic medical conditions, which may result in increased obstetrical risks, adverse birth outcomes, and neonatal complications like prematurity and lower birth weights. IVF success rates decline between ages 35 and 45, emphasizing the importance of freezing eggs while women are still younger. Freezing eggs at this age increases IVF success with the pregnancy rates of 4.5 to 12% for women in their mid-20s and mid-30s. However, recent advancements have made pregnancy tests for IVF using frozen oocytes comparable to fresh oocytes. A woman freezing her eggs at 35 could benefit from a success rate of 38% in her 40s compared to 20% without freezing.
Following the introduction of this innovation to the public, certain questions have been formulated, such as whether countries with publicly funded ART should extend coverage to social freezing. One potential objection to providing full coverage is the concern that it could lead to suboptimal allocation of scarce healthcare funds. Many countries struggle to meet the demand for ART, but women would willingly undergo uncomfortable procedures like ovarian stimulation and oocyte retrieval as long as they want it. As an example, Israel has emerged as one of the first countries to regulate and authorize public support for social egg freezing. This procedure empowers women to exercise reproductive autonomy, aligning with liberal ideology and promoting informed consent. Given this, a relational approach to autonomy, considering women's choices, is therefore deemed more suitable. Likewise, advocates for extending coverage argue that social freezing is a legitimate reproductive choice for individuals who wish to preserve their fertility options. They emphasize the importance of reproductive autonomy and argue that public funding should support a range of reproductive choices, including non-medically necessary procedures like social freezing. However, when considering this procedure, it is important to reflect on the ethical challenges women face in balancing professions and motherhood, as it can disrupt career plans. It is also important to note that media reports highlighting pregnancies in women around the age of 50 can create a distorted perception of reality. Meanwhile, young women should be aware of natural limits of human fertility, especially as a medical necessity. Some argue that social freezing does not meet the threshold of medical necessity and therefore should not be covered by publicly funded programs. They believe that limited resources should be prioritized for medical conditions. Additionally, accurate information reduces the chances of involuntary childlessness. Hence, this also prevents viewing egg freezing as a commercialized reproductive insurance policy.
Alongside the continuing development of oocyte cryopreservation or egg freezing in assisted reproductive technology came the development of oocyte donation via egg banking. Particularly, oocyte donation has become a treatment option for large numbers of women experiencing age-related infertility, leading to an increase in its demand. It allows recipients to review a list of donors and minimize waiting times. Let us now talk about the willingness of women to participate in oocyte donation and egg banking. When talking of oocyte donation, women might be more willing to donate their eggs to other people if there are already spare oocytes that are already in storage which they do not need for themselves. This could happen when their own frozen oocytes from past ART treatments remain unused due to many reasons such as sticking with natural conception, breaking up with their partner, the loss of desire to have children, or even death. In comparison to this, women are said to be less likely to donate their eggs if they have to go through special treatments to retrieve the eggs specifically for the purpose of donation, or if donating means that they will have a lower chance of getting pregnant themselves. Additionally, there are some considerations when donating, which includes physical and psychological burdens. Firstly, one thing to consider before donating eggs is the presence of physically demanding procedures. This includes ovarian stimulation, which uses hormonal medications, followed by oocyte retrieval, which is done under anesthesia. More than the physical aspect, the psychological burden of becoming the genetic parent of a child that one does not know shows to be of higher regard. Most women are emotionally troubled by the thought of their genetic child growing up in an unfamiliar family. This means that even if the physical burden is removed, it is unlikely that a large number of women with extra eggs will choose to donate them for reproductive purposes. However, directed donation to family members and relatives, or the involvement of personal benefits, either cash or in kind, may be some factors that can push women to donate despite the physical and psychological burdens mentioned. Now, all things considered, here are some of the practical benefits from the use of donor egg banks for oocyte donation. First is simplified ART cycles. With egg banking, there is no need for menstrual cycle synchronization between donor and recipient. Next is cost reduction. When there is a large pool of egg donors available, it becomes easier and faster for people who need eggs to find a suitable match. This efficient allocation of eggs from many donors to multiple recipients can help reduce costs and allow recipients to have more choices in selecting a donor without having to wait for a long time. Next, safe storage and donation. Egg banking allows for the option of keeping eggs in storage for at least 6 months to retest donors for safety before using the eggs for donation. And lastly, multiple recipients. Egg banking allows the sharing of eggs among multiple recipients without the need for synchronizing the uterus lining or endometrial synchronization, which can make the treatment more cost-effective and accessible to more people. Those are just some of the considerations as well as benefits with regards to oocyte donation via egg banking. Let us now move on to the future perspectives in technology to be presented by LICARDO.
Now, let's move on to tackling the future of social egg freezing and banking. These procedures can serve as a form of fertility treatment for the LGBTQIA+ community and for unmarried persons, moving society closer to accepting that reproduction does not necessarily need to follow heterosexual norms. This makes it more difficult to justify the denial of assisted reproductive technologies based on sexual orientation or marital status. In 2013, the American Society for Reproductive Medicine called for programs to provide fertility services equally to all, stating that they must treat all requests for assisted reproduction equally without regard to marital or partner status or sexual orientation. They noted that the development of children are not harmed by being raised by same-sex parents, nor that the physical autonomy and religious freedom are not legitimate basis for discrimination. Overall, there are many deep ethical questions yielded from the discussion of egg freezing, such as does non-medical egg freezing promote sex equality or undermine it? Does it enhance human health and well-being, or does it actually encourage a harmful artificiality? While there is no singular correct answer to these questions, one's answer largely depends on their own normative frameworks and their own understanding of sexual inequality, biomedicine, health planning, and medical technology. In general, the different health needs of men and women must be recognized in order to define equity, which should be necessary in the consideration of public health policies. To conclude our presentation, the cryopreservation of oocytes is a viable form of technology that can allow women to achieve pregnancy in their later years. There is still much left to discuss in regard to the biomedical issues linked to this, including gender equality and discrimination, and the finiteness of human life. In general, the effects on society of social egg freezing, from relieving the pressure of finding the right partner to fertility assessment and counseling before preservation, are yet to be tackled. While social freezing is a possible solution to fertility problems, it could also create further challenges for us in the future. Thank you very much for listening to our presentation. We hope you learned a lot. Feel free to ask us any questions.